علیرضا سربازی هستن، فعال حقوق بشر که سخنرانی خودشون رو آغاز کنند.
با سلام خانم ها آقایان، بیش از هر سخن مایل هستم از طرف خودم، از طرف CFPPI The Committee to Free Political Prisoners of Iran و همه زندانیان سیاسی و عقیدتی مراتب امتنان و سپاسگزاری خودم را از سودویند و رابطین ایرانی این سازمان غیردولتی ابراز کنم. طبق گزارش‌های واصله ظرف ماه گذشته خورشیدی تعداد 67 مورد نقض حقوق زندانیان سیاسی و عقیدتی در مورد 117 زندانی سیاسی در ایران ثبت شده که 22 مورد از حد مورد انتظار برای ثبت در پریود زمانی مشابه در سال گذشته بیشتر بود. موضوع گزارشی که خدمت شما ارائه می‌کنم اعدام‌های خاموش است. از بین تعداد بیشماری زندان گزارش خودم رو بر روی موارد نقض حقوق زندانیان در زندان رجایی شهر متمرکز کردم، زندانی مخوف که به باستیل ایران معروف شده و همین واژه زندان باستیل فکر می‌کنم به تنهایی برای تشریح وضعیت دهشتناک و غیر قابل تحمل زندانیان در این مشهورترین زندان ایران کافی باشه. گزارش رو برای ارائه به مسئولین ذی‌ربط و سازمان‌های حقوق بشری به صورت انگلیسی تنظیم کردیم و من ترجیح میدم متن رو به انگلیسی خدمت شما ارائه کنم. خب خیلی عملی‌تر هست از این که من بخوام همزمان به فارسی ترجمهش کنم. A report on deprivation of urgent medical care in RajayiShahr prison in Iran. RajayiShahr prison is located in the town of Gohardasht near the well-known city of Karaj, 20 kilometers west of Tehran. Purposely withholding urgently needed medical care from political prisoners has always been commonly used by the Islamic Republic as a form of torture for both the prisoners and their families. On rare occasions where medical intervention is granted, the prisoner is subjected to humiliating physical abuse and or torture in exchange for the treatment. According to reports received by CFPPI, the Committee to Free Political Prisoners in Iran, directly from prisoners via telephone conversations, the authorities have intensified this practice in the last few years. As a result, many prisoners have decided not to seek medical care as the abuse following their return from the hospital is even more unbearable than their original medical condition. These reports also included the extension of abuse to the families of the prisoners. For instance, in 2012, on visitation day for Section 12 of RajayiShahr prison, the authorities purposely kept the families waiting for the last 3 to 4 hours before leading them through a 1-kilometer long narrow corridor to the visitation room. There, they are permitted to visit for 10 to 20 minutes. Section 12 of RajayiShahr prison is overcrowded with political prisoners in grave medical condition who are in need of immediate medical attention. Among these prisoners, to name just a few are Ibrahim Babai Tabakkoli, in prison for his Baha'i faith, Mashallah Haydari, Misaq Yazdan Nejad, Saleh Kohandan, and around 60 more just in this section alone. Some of the cases are as follows. 21st of June 2013, Afshin Osanlu, 42 years old, a jailed worker and political prisoner, lost his life as a result of heart attack. According to Afshin's family, prior to his death, He didn't have any record of heart problem. Afshin lost his life as a result of deliberate withdrawal of the necessary medication by the prison officials, which caused him suffering a heart attack. 24th of December 2012, serious lack of medical attention that are ill and in dire need of an immediate medical care is still a huge pressure on the political prisoners of Section 12 of RajayiShahr prison, and lives of many prisoners are in a grave danger. This is how the issue of medical attention has been taken care of in RajayiShahr prison. Independent doctors who agreed to attend the prison to visit ill prisoners are body searched in an insulting way, and because of the way they are treated, many of them refuse to see ill prisoners in the prison. In occasions that prison authorities bring doctors to this prison, the quality of medical care provided by these doctors in these and other prisons are very poor. Sometimes they see 50 patients in only 30 minutes. In addition, doctors who come to the prison usually insult prisoners, maltreat them, and they have the backing of the prison authorities. If medications are needed with permission from the prison authorities, the families of the prisoners provide them. Otherwise, prisoners do not receive their medication, or when they do, they have to wait for a long time. More than half of the political prisoners in Section 12 of RajayiShahr prison are suffering from mental health issues and need to use antidepressants. Many of them also suffer from severe headache, arthritis, backache, joint disease, kidney problem, sick disease, prostate problems, cancer, blood pressure, stomach and intestine problems, and many more. The quality and quantity of food given to the prisoners has fallen, and this has affected the already deteriorated health of prisoners. In December 2012, 11 prisoners, including 7 Baha'i, were transferred to the Section 12 of RajayiShahr prison. This has added more pressure to the prisoners in this section because of the overcrowding. The space in this section is not enough to hold this many prisoners. There are already more than 64 political prisoners in this section, and prisoners have already complained about lack of enough space, but instead the prison officials have transferred 11 more political prisoners to this section. The psychological and physical torturing of the prisoners in Iran is not acts of individual prison officials, and they are an isolated act. The prison authorities are under direct order from the Ministry of Information, that is in turn take their orders from the cabinet, president and supreme leader. The whole chain of command within the Islamic regime are designing and implementing the prison policies, such as torturing and executing the prisoners. 15th of October 2012, the regime once again has deliberately slowed the process of medical care for political prisoners. The political prisoners in RajayiShahr prison must now go through a long process in order to be able to see a doctor, specialist, having a scan, MRI, and other necessary tests. In order for prisoners to have medical care, first their families need to book an appointment with a doctor outside the prison and fax the appointment to the prison officials. Then the prison officials have to send the fax to the prosecutor's office, which is called Dadsetani. In the best case scenario, it will take between 20 to to 30 days for the above organization to issue a permit for prisoners to be taken to their appointments. The report mentioned that in many cases, prison officials receive the permit but do not action it, deliberately block the process, and as a result, the prisoners are unable to see a doctor. فکر می‌کنید چقدر وقت داره آقای؟ Okay, I have 3 minutes more. This is the case even for prisoners who are suffering from severe and life-threatening illness such as cancer and tumor. The condition of Mr. Saleh Kohandan as an example in RajayiShahr prison. Mr. Saleh Kohandan, who suffers from intestinal bleeding, high blood platelet count due to suspected lymphatic cancer, was finally sent to a hospital in June 2012. They quickly returned him to prison without completing the required laboratory tests. It was reported that during this brief stay at the hospital, Mr. Kohandan's feet were shackled to the bed. When both he and his family objected, and shakeless are usually used for common criminals and not for political prisoners, they were met with most abusive language and ridiculed. Mr. Mansour Radpour died on the evening of 21st of May 2012 in RajayiShahr prison in Iran. Political prisoner Mansour Radpour was kept in Division 4, Section 12 of RajayiShahr prison when he died of a stroke. Mr. Radpour has been suffering from kidney and heart problems along with diabetes and had repeatedly asked prison authorities for medical help. His requests were continuously rejected, although only once he was sent to a medical facility too ill-equipped to deal with his conditions. Mr. Radpour had initially been sentenced to 3 years in prison. However, at the time of his death, he had languished in prison for 5 years. This is because near the end of his sentence, the officials tampered with the details of his file in order to keep him in prison, perhaps indefinitely. As a result, Mr. Radpour suffered from the most severe form of depression. Furthermore, his repeated pleas for permission for a visit by his very young daughter were denied. He died alone in a solitary cell after 5 years of being purposefully refused even the most basic medical treatment. البته نمونه‌های دیگری هم هستش این گزارش. متاسفانه به علت کمبود وقت من خلاصه میکنم مطلبم رو. فقط در پایان مایلم عرض کنم از طرف خودم و سایر دوستان همکار در پنل زندانیان سیاسی که آزادی تعداد زیادی از زندانیان سیاسی در ظرف هفته گذشته یک حرکت مثبت و قابل تقدیر بوده. علیرغم درک این مطلب اضافه میکنم که تمام زندانیان آزاد شده در هفته گذشته در ایران به جز خانم نسرین ستوده زندانیانی بودند که در دسته‌بندی ها جزو زندانیان اصلاح طلب به شمار میرفتند و اصولاً از حق قانونی برای مرخصی متصل به آزادی استفاده کردند. خیلی ممنون.